Continuing here with the antihelminthic drugs, so anti-worm drugs. I have a few things here. Niclosamide prevents ATP production and treats tapeworms. Praziquantel alters membrane permeability, treats tapeworms and flukes. That was actually pretty popular. And mebendazole and albendazole, they interfere with nutrient absorption, treat intestinal helminths. So they would be also used in with animals a lot. Ivermectin is also very popular for in vet medicine. It actually is interesting. That one paralyzes the worm, and then the worm gets flushed out. Treats mostly roundworms and mites. Okay, so now let's take a look at how we can test the effectiveness of a drug. One of the best tests is the diffusion method, also known as the Kirby-Bauer test. And it's basically a test where you are adding your antimicrobial agent that you want to test. You're adding this to a little filter paper disc, and then you're putting that filter paper disc on a plate that has been swabbed out with the bacteria that you want to test out. And then you will let your bacteria grow, and the chemical is diffusing out of the disc that you put it in, and then you want to see whether this chemical is able to inhibit bacterial growth. And what you're going to end up measuring is the zone of inhibition. You're going to literally take a little ruler piece and you're going to measure the millimeters of diameter of the zone of inhibition. So it's easier to take a look at that on an actual plate. So here's what that would look like. Here you have all these little filter paper discs that were loaded up with different chemicals, and then you measure the zone of inhibition. So let's say you're starting out here, you measure from here to here. The diameter, and then you look up whether that represents real inhibition or it's not effective. So you're going to classify in the end each drug that you are testing out either as effective, intermediate, or not effective, so not sensitive. That bacterium is not sensitive for this drug. Here you can see that this is totally ineffective, no zone of inhibition at all. This one here looks like it's the best one. So there we have a nice big zone of inhibition you would measure across and then report the millimeter result. Then you go to a chart and compare what that means, that diameter, if that's would be considered effective or sensitive or not sensitive. You can also do an e-test, and that one measures the minimal inhibitory concentration. That means now you have a test strip that has the antibiotic or the chemical that you want to test in different concentrations. And there you can see the lowest antibiotic concentration that will prevent bacterial growth, and here's what that would look like. So here you have your this strip right here contains the antibiotic that you want to test in different concentrations. You can tell at these very low concentrations, totally not effective at all. And then you see that it starts to inhibit the growth of bacteria more and more and more. And you would have to also find the diameter of inhibition, sort of going across to find the minimal inhibitory concentration for that particular antibiotic against those bacteria that are grown on this plate. Another method that would measure the effectiveness of antibiotics would be the Broth dilution test. There you determine the minimal inhibitory concentration and the minimal bactericidal concentration of an antimicrobial drug. So you can test that in wells, and let's take a look at that. It's probably easier to take a look at it on an actual plate. So you have these little wells here that contain different concentrations of your drug. You're testing doxycycline here, and you can tell there's growth in each one of these wells. That means this particular antibiotic is not effective at all. So the bacterium is resistant in this case. Here, this would be sulfamethoxazole. That one is not very good. At very high concentration, it does inhibit the growth, but you would have to have very high concentrations. Streptomycin looks like it's great. No growth in any of the wells, so that means the bacterium is sensitive at all concentrations. So that will be the best out of these bacteria that are being, out of these antibiotics that are being tested here. Streptomycin will be the treatment of choice for the bacterium that was plated in here. Ethambutol and kanamycin are okay, but not as good as streptomycin. Now let's talk about resistance to antimicrobial drugs, which is a big problem these days as more and more bacteria are getting resistant to our available antibiotics. Here's some terms that you should know. You probably have heard of superbugs. We'll get to that in a sec. Persister cells, maybe something you haven't heard before. Those are microbes with genetic characteristics allowing for their survival when they expose to antibiotic. Now, superbugs, those are multi-drug resistant bacteria. They are very dangerous, especially in hospital settings. Every hospital is just terrified of having these superbugs because they are able to share their resistance traits with other bacteria. And if you have these patients that are just coming out of surgery or they're immunocompromised, it could be really life-threatening, actually. Let's take a look at how these bacteria are managing to become resistant against different antibiotics. So there's, of course, penicillinase. That's the first thing that bacteria invented to get around the penicillins. All you have to do is chop up the beta-lactam ring of the penicillin, and then the drug is no longer effective. So that would be enzymatic destruction or inactivation of the drug. They can also prevent penetration to the target site within the microbe, so the bacterium basically somehow blocks the antibiotic. They could become resistant by altering the drug's target site. They could kick out the antibiotic, so that would be ejection of the antibiotic, just get it out before it can harm the bacteria. Or they could vary their mechanisms of resistance, sort of alternating between various mechanisms. So this slide here shows you the various mechanisms of resistance to antibiotics that bacteria can develop. Number one, they can block the entry. They can inactivate the drug by using enzymes. They could alter the target molecule for the drug. They could kick out the antibiotic, so efflux, just kick it out. Those are the main mechanisms. Here's what it could look like when somebody's being treated with an antibiotic and then develops an antibiotic-resistant mutant bacterium. So you initiate the antibiotic therapy, everything looks good, bacteria count is going down, and then the drug-resistant mutant starts to appear, and now the antibiotic's no longer effective and bacterial counts go right back up. Much of the antibiotic resistance that we see is actually due to misuse of antibiotics. And basically when you're using antibiotics for the wrong reason or at the wrong concentration, then you are basically selecting for resistant bacteria and helping them out to develop that kind of resistance. So that kind of misuse would include that somebody's taking an outdated or weakened antibiotic, something that got watered down, using an antibiotic for the common cold or for other viral infections where it's absolutely useless, using antibiotics in animal feeds at large concentrations, and then failing to complete the prescribed regimen. That's a popular one. People feel better. They think, oh, I don't need this anymore, so let's just not take it to the end. Or using somebody else's leftover prescription just for a few days. That means that you're exposing the bacteria to the antibiotic. It's not effective, but it gives the bacteria a chance to figure out what they could do about this drug that is trying to kill them or reduce their viability. Antibiotic safety. So there is a therapeutic index, and you always want to weigh the risk versus the benefit of taking an antibiotic. Risk could include that the antibiotic could react with other drugs. It could be drug interference or drug problems, that the two drugs are not compatible. There could be damage to organs. Chloramphenicol, for example, is an antibiotic that you really only want to take when you have nothing else available. Also, during pregnancy, there might be a risk to the fetus. It has to be weighed against the benefit of a antibiotic treatment. When it comes to drug interaction with one another, there are two terms that you need to know. Synergism means that the two drugs together have a greater effect than you would expect from either one of them alone. Antagonism means that the drugs are inhibiting one another, so that the two drugs together have less of an effect than either one of them alone. Here's an example for synergism. You have two different antibiotics, and they individually have a certain inhibitory effect on this lawn of bacteria here. Each one individually has an effect. This one here is a little bit better than that one, but together you can tell that the zone of clearing here and the inhibition of the bacterial growth is greater than each one of these two drugs would produce alone. Now let's talk about the future of chemotherapeutic agents. Right now it's still an arms race, and people are trying to find new antibiotics, especially for all those super resistant superbugs that are out there, the vancomycin resistant bacteria, the methicillin resistant bacteria. We're really running out of options, and people that acquire those super resistant superbugs, if they get an infection with, let's say, meningitis, a bacterial meningitis, and they really need an antibiotic to work, is scary. Because if the antibiotic doesn't work, they're dead. So there are a few new things on the horizon. There are some new peptides, antimicrobial peptides, that are produced by various organisms. They found that certain reptiles and amphibians have antimicrobial peptides in their skin that might be useful for future antibiotics. Phage therapy would mean that you are trying to infect the bacteria that make you sick with a bacteriophage, a bacterial virus that then attacks the bacteria. So that's a possibility. Bacteriocins, those antimicrobial peptides produced by bacteria themselves, so sort of using the ideas the bacteria themselves come up with to outcompete other species of bacteria, to exploit that for potential future antibiotics. And this concludes our discussion on antimicrobial drugs. I realize that there are a lot of different drugs mentioned here in this lecture, and it could be confusing. There's a lot of information. I try to emphasize the ones that I think are most important for you guys. So please follow that and study what I told you in this lecture that is important, and sort of the stuff that I mentioned is not so important. You can leave those out because you will not test it on those. Also, the new lab stir exercises. There is one on antimicrobial treatment and drugs on there that I highly recommend you guys do. I put it in your assignments, and so you are ready to do this exercise and take a look at that, what that antimicrobial testing might look like in the lab. Like a Kirby-Bauer test is in this lab, and at least you get to do this while not in a real lab, but at least you get to do it in a simulated lab.